Are you a menopausal woman who's dealing with bladder issues? My name is Dr. Brooke Kalisiak. I'm a pelvic physical therapist and the owner of Legacy Physical Therapy in St. Louis, Missouri. And today I'm going to talk about something that not enough people are talking about: bladder leakage with menopause. If you've noticed that you're leaking with cough, laugh, sneeze, or maybe you can't quite get to the bathroom in time without a little bit of urine coming out, I'm here to tell you you're not alone. But here's the thing. Bladder leakage after menopause is common, but it is not normal. And it is not simply something that you have to accept. There are things you can do to prevent it and to get over it if you're experiencing it. So in this video, we will be diving into potential causes of leakage and, more importantly, some tips that you can do to help if you're experiencing these symptoms. So first, why does bladder leakage start to show up more commonly during and after menopause? Let's go through a few of the key reasons here. Number one, estrogen declines. Estrogen plays a major role in the health of the tissues of the bladder, urethra, and surrounding pelvic area. When estrogen declines, we can see several changes in the area. Tissues become thinner and less elastic. Blood flow reduces to the pelvic area. Muscles supporting the bladder can become weaker, and the urethra can lose its ability to seal as effectively. All of this can lead to either stress incontinence, that leaking with a pressure situation like cough, laugh, or sneeze, or urge incontinence, that gotta go feeling and not being able to make it into the bathroom in time once you feel the urge. Another contributor to bladder leakage during menopause is pelvic floor dysfunction. The pelvic floor muscles are a bowl of muscles on the bottom of the pelvis that support our pelvic organs, especially our bladder and urethra. And there can be changes that occur to them during menopause that can be problematic. During menopause, the pelvic floor muscles may weaken from lack of use and that drop in estrogen. They actually may be too tight and tense because of existing pain issues or stress issues, or they may have trouble coordinating together with other muscles and doing their job effectively to provide that sphincter-like closure around the urethra. In addition, many women already have underlying pelvic floor dysfunction from things like childbirth, back injuries, abdominal weakness, you name it. These things throughout our lifetime can all contribute to extra stress and strain on our pelvic floor. And so when both the estrogen content in the area decreases during menopause and we have that pre-existing condition of a pelvic floor dysfunction, women may notice this showing up as the symptom of bladder leakage. A third factor contributing to bladder leakage during menopause is that menopause has a direct effect on the bladder itself, and we can see behavioral changes in the bladder. Our bladder can become more sensitive. We can notice more frequent urges to urinate, and we can notice over time a decreased ability to hold it, and that again contributes to a more frequent need to go to the bathroom. So it's about how the whole system works together. It's not just about the muscles or just about the hormones, but the whole area is affected by the changes that occur with menopause. Let's quickly go over the 3 common types of bladder leakage that happen for postmenopausal women. First is stress incontinence. This is a pressure situation where we leak with cough, laugh, sneeze, running, jumping, or exercise. Second is urge incontinence, and this is when we get the feeling that we have to go to the bathroom and we can't get to the bathroom in time, and therefore some leakage happens. For some women, it's only a few drops right as they enter the bathroom and are undressing to sit down to urinate. For other women, this type of leakage can happen the minute they feel the urge to go. They can't even stop the flow when they get up to go to the bathroom. The third type is mixed incontinence, and this is a combination of both stress and urge incontinence happening at the same time. Now that you know what contributes to bladder leakage during menopause and what the different types of bladder leakage are, we can go into different tips to help you overcome it. Now here's the good news. Bladder leakage is almost always treatable and usually without medications or surgeries. So let's go into a few tips that you can implement right away to help you get over your postmenopausal bladder leakage. Tip number 1, see a pelvic physical therapist. Let's take the guessing out of what is causing your leakage. Let's have you get a full evaluation where we look at your posture, your core muscle strength, what your pelvic floor muscles are doing, what your bladder habits are, and we get a comprehensive assessment of what is personally going on with you so that you can get an individualized plan to know what you need to work on to overcome your leakage. It takes the guessing out of it and lets you know that you are working on the right things and putting yourself down the right path to get leak-free. Tip number 2, do not just do Kegel exercises. If you don't know, a Kegel exercise is a contraction of the pelvic floor muscles. When the pelvic floor muscles contract, they lift up and into the body and squeeze off around the holes. So yes, the pelvic floor muscles are intimately related to our bladder function and whether or not we're experiencing leakage, but just doing Kegels without first assessing what's going on with your pelvic floor can actually make things worse and can cause more problems in the area. Unfortunately, many women are unaware of what their pelvic floor muscles are doing on a regular basis. And one of the common things that we see in many of our patients is that their pelvic floor muscles are held really tight and tense and not relaxing and letting go well. And this can lead to its own host of problems. But if we throw doing Kegel exercises on top of that, more contraction of those muscles, we end up with no effect actually, and oftentimes worsening of leakage symptoms. So don't guess. Don't just do Kegel exercises, even if that's the recommendation that your doctor gave you. You are better off getting your pelvic floor and your whole body assessed to see how the system is working together versus just guessing on which exercises are going to work for you. Tip number 3, you want to address your bladder habits. Things like going to the bathroom just in case, limiting your fluid, hovering over the toilet, or being a power peer can all lead to your bladder being overactive and kind of more in charge of what's going on. And this can be problematic over time. I have done other videos talking about proper toilet and bladder techniques and habits, so I refer you to this video here to go learn about them more in detail. But when we get in control of some of our bad bladder habits, that can make a significant change on whether or not we're experiencing leakage. Tip number 4 for menopausal bladder leakage, consider vaginal estrogen. In many cases, vaginal estrogen can help to improve tissue elasticity and health and bladder function. This is different than a hormone medication that you would take orally. This is something that you would use just locally in the vaginal canal. As a pelvic physical therapist, I cannot prescribe vaginal estrogen, but I'm oftentimes having a conversation with my patients to recommend that they go talk with their doctor about the potential benefits of the introduction of vaginal estrogen into their treatment regimen. So it is worth having the discussion with your medical provider about if vaginal estrogen can be helpful for you. So if you've been dealing with bladder leakage during menopause, I want you to know you are not alone. It is not just a normal part of aging, and there are real solutions out there that you can do to help get yourself back to being leak-free. If you are ready to learn more about how menopause affects your pelvic health and what you can do to feel strong, supported, and symptom-free, I want to personally invite you to our upcoming webinar called Menopause Strong. It's happening on Thursday, October 16th at 7 p.m. Central Standard Time. And in this webinar, we will be going over all things related to pelvic health and menopause and what you can do to optimize your body for this change in your life. We will also be hearing from my colleague, Jen McDaniel, a registered dietitian who will be going over nutritional strategies to support yourself through menopause and beyond. So we hope that you can make it there. You can click on the link in the YouTube description to sign up for the class, but we really want to make sure that you feel empowered through your menopausal journey. So we hope to see you at Menopause Strong. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.